Now, the mounting pressure on our hospital system has affected the city's EMS Council guidelines on how emergency crews will now respond to cardiac arrest calls. CBS 2's Lisa Rozner live now on the Upper West Side with these details. Lisa.
Well, Christine, as one first responder told me, this is like war. They will still do everything they can to revive a patient on scene. But if they cannot, they will no longer take a patient to the hospital. City calls to 911 for cardiac arrest are up almost 50%. The president of the EMS Officers Union says ambulance crews are using the same tactics on scene as an emergency room to restart the heart.
You have to have people doing CPR, people calculating drugs, intubation. A lot of high-risk procedures have to be done.
And those will continue to be done. If crews can get a heartbeat, the patient will be taken to the hospital. But if unsuccessful after some time, new rules effective immediately by the Regional EMS Council of New York City say first responders will pronounce the person dead instead of taking them to the hospital.
This is not going to be something that is going to endanger people.
The American Heart Association agrees because the chance of the hospital reviving the person after EMS fails is extremely slim.
That's where you're going to see the most benefit, is within those first 20 to 30 minutes of that resuscitation effort.
VP of the EMS Officers Union, Anthony Almaguera, says with around 20% of first responders out sick and increased calls, the sooner the ambulance can come back online, the more lives it can save.
This is a wartime mentality when it comes to the front lines here.
He says recently a crew at Brookdale Hospital waited 2 hours just for staff to find a stretcher. CUNY Graduate School of Public Health professor Dr. Bruce Wiley says delays like this are becoming more common as crisis standards of care are being utilized inside hospitals now.
There will be patients who are, quote unquote, successfully resuscitated in the field, but still are very sick, and then have to be brought to these hospitals, so they're going to need intensive care as well. Ventilators is one of the key scarce resource, which is will determine, literally whether people live or die.
And this change is also being made by EMS crews on Long Island. But officials want to remind the public, if you are experiencing chest pain or having trouble breathing, do not be afraid to call 911. On the Upper West Side, Lisa Rozner, CBS 2 News.